Hello my viewers and welcome back to the channel. In today's video, I'm going to be telling you about the 3 stages of labor. I will explain what these stages look like, what exactly to expect in each stage, and how long each of these stages lasts. So it is going to be really practical, and these are exactly the things you will see happening in each of these stages, both while you're at home and in the hospital. In fact, having this knowledge will help to get you prepared and confident as you step into that labor room. If you enjoy this kind of content, please do not forget to subscribe to my channel and give this video a big thumbs up as you watch. In this channel, I talk about fertility, women's health, and everything health. So let's get started. Simply put, labor has 3 stages. The very first stage is divided into 2, which is the latent phase and the established labor. When we talk about the latent phase, it is simply that phase when your cervix begins to dilate so that your baby can be born. You may begin to feel irregular contractions, but it may take a few hours or even days before you are in established labor. And in fact, this is the longest stage of labor. In this phase, your contractions may range from being slightly uncomfortable to being a little bit painful. There is no set pattern as to how many contractions you get or how long they last. During this stage, it is a very good idea to have something to eat or drink if you can, because you will definitely need that energy when you are in established labor. Also, if your labor begins at night, it is a good idea to try as much as possible to relax and sleep if you can. If your labor starts during the day, try to be upright and also move around as much as you can, because this can help your baby to move down into the pelvis and also help you to dilate faster. Having breathing exercises, a warm massage, and even a warm shower can really help you to feel comfortable and even help in easing the pain in this latent phase of labor. And this takes us straight into the actual first stage of labor, which is the established labor. So what is established labor? Established labor, which is the actual first stage of labor, is when your cervix has dilated up to 4 centimeters and your contractions has become even stronger and more regular. At this point, your midwife will regularly check on you to find out how you're progressing and offer you all the support you need, including pain relief if you need it. During this stage, you can either walk around or stay in any position that is more comfortable for you. Your midwife will offer you regular vaginal examination to find out how you are progressing. And at the time when your cervix opens up to 10 centimeters, then your baby is ready to be born. And at this point, it is said that your cervix has been fully dilated. If you are a first-time mom, it takes about 8 to 18 hours from the time that labor is fully established to the time that you are fully dilated. In simple terms, it simply means that the first stage of labor would take you about 8 to 18 hours if you're a first-time mom. That is, it can take 8 to 18 hours for you to move from 4 centimeters to 10 centimeters. But for a second and third pregnancy, it ranges between 5 to 12 hours. So when you finally get to the end of the first stage, you will feel a strong urge to push. Still in this first stage, your midwife will regularly monitor you and your baby to be sure that your baby is coping well. Your midwife will check your baby's heart rate every 15 minutes using a handheld Doppler. This device helps your midwife to know exactly how your baby is coping with the contractions. However, during this period, you have the liberty to move around whenever you want to. And this is really good for you because it's going to help to make the baby move down into the pelvis the more and help to improve cervical dilatation. However, if your midwife has concerns regarding you or your baby, or you choose to have an epidural, your midwife might suggest an electronic monitoring of you and your baby. However, this can also impact on your mobility because you will have to lie down to have this monitoring done. This method of monitoring involves strapping 2 pads on your abdomen. One of them will monitor your fetal heart rate, that is your baby's heart rate, while the other one will monitor your contraction. So this method is also good and is always required when there are concerns regarding you or your baby, or when you've chosen to have an epidural. Remember that the first stage of labor is the longest stage of labor, and sometimes labor can be slower than expected. This can happen if your contractions are not regular enough, not strong enough, or your baby is in an awkward position. And when this is the case, your midwife will usually suggest two ways to help speed up labor. This can be either breaking your waters or the use of oxytocin drip. If your waters have not yet broken, your midwife will likely suggest that your waters be broken at this point. That simply means that during one of the vaginal examinations, the midwife or your doctor will simply break that membrane that contains the fluid surrounding your baby. In my previous video, I talked about this amniotic fluid. So at this point, if it hasn't broken before you got to this stage of labor, they will break it, and it is known as the artificial rupture of membrane. When this is done, it will actually help to improve your contractions, making them more stronger and regular. And also, your midwife or doctor will talk to you about the options available for pain relief. Then, the second way to speed up labor at this time is the use of oxytocin drip. This oxytocin drip also helps to improve the regularity and the strength of your contractions. So, when you've been given this as well, you will be given options for pain relief. You will also be offered electronic monitoring of your baby and regular vaginal examinations. This electronic monitoring will help to find out if this oxytocin is working as expected. And this nicely takes us into the second stage of labor, which is also known as the pushing stage. This second stage of labor begins from when you are fully dilated, that is 10 cm dilated, to the delivery of your baby. Now, when this is the time, your midwife will really help you to get a comfortable position for birthing. You could decide to stand, kneel, you can also decide to squat. So, for a tip, I would say if you're having a lot of back pain, kneeling on all fours can be really helpful. Now, having assumed the comfortable position, it is also very important that you now start pushing. But a quick tip is that when it comes to choosing birth positions, it is encouraged that during the time when you're still pregnant, you're not yet in labor, you can decide to try out these positions with whoever will be your birthing partner so that they will know exactly how to help and support you during this stage. Since you're fully dilated, your baby will move further down the birth canal and you will begin to feel the urge to push. This urge to push feels like that urge you have when you want to have a poo. Now, when you have this urge, you are expected to push during contractions and rest in between contractions, and your midwife will guide and support you at this time. However, if you've had an epidural, it is very unlikely that you will have any urge to push. So your midwife will monitor your contractions and tell you when to push and when to rest. If you're having your first baby, this pushing stage should take not more than 3 hours. But if you're having your second, third, or fourth, it should take not more than 2 hours. To be honest, this second stage of labor is hard work, but your midwife and birthing partner will support you throughout the stage. As soon as your baby's head is born, I think most of the hard work is over, and the rest of the body is usually given birth to within the next 1 to 2 contractions. When your baby's head is almost ready to come out, your midwife will tell you to stop pushing. Take some short breaths and slowly breathe them out through your mouth. This is done to help the head of the baby to be born slowly and gently, and to give the perineum enough time to stretch. Sometimes your midwife or doctor may suggest an episiotomy. This helps to prevent laceration and also to speed up delivery. Before you are giving this episiotomy, a local anesthetic agent is going to be given to you just around the perineum, and then a cut will be made. After delivery, this episiotomy is stitched by your midwife and it heals really nicely. Once your baby is born, most of the hard work is over, and the rest of the body is usually given birth to in the next 1 or 2 contractions. And as soon as the baby is fully delivered, the baby is given to the mother to have some skin to skin time together. At this point, you can begin to breastfeed your baby as soon as you are able to do so, but it is ideally recommended that the baby should be breastfed within the first 1 hour of birth. Having completed this stage, it is now time for us to talk about the third stage of labor. What actually happens in this stage? The third stage of labor happens after your baby is born. Your womb begins to contract and the placenta is delivered. However, there are two ways to manage this stage. We have the active management of the third stage of labor and the physiological management. The active management is simply when treatment is required to make this process happen, while the physiological management is when you allow this process to happen naturally. But at the time when you're pregnant, your midwife or doctor will discuss these two types so that you can decide which one you want to use. However, there are situations where physiological management is not advisable, and your doctor or midwife will discuss this with you in advance if that is the case with you. So, in this active management, oxytocin injection is usually given on your thigh as soon as the baby is born. This helps your womb to contract very well. Evidence also suggests that it's better to not cut the umbilical cord immediately the baby is born. So your midwife will usually wait to do this between 1 to 5 minutes after the baby has been born. And as soon as the baby is born, your midwife will usually pull that cord that is attached to the placenta to pull the placenta out of the vagina. And this process is usually expected to happen within 30 minutes after the baby is born. So in conclusion of this active management, it helps to speed up the delivery of placenta. It can also reduce the risk of postpartum hemorrhage, but however, it can make after pains worse. In the physiological management, as I mentioned earlier, it happens naturally. So no oxytocin injection is administered and the placenta is delivered naturally. However, the umbilical cord is only cut between 2 to 4 minutes after the baby has been delivered, when the umbilical cord has stopped to pulsate. So this is the difference between the active management and the physiological management. Now, in this physiological management, the process can take up to an hour. In summary, the difference between the two is that active management is more faster and can help reduce the risk of bleeding, that is postpartum hemorrhage, while that of the physiological management can be quite slower, but it doesn't require the use of medication. And when it comes to cutting the cord, it is done usually between 2 to 4 minutes, while in active management, it is between 1 to 5 minutes. But if for any reasons while having the physiological management and the placenta refuses to come out, you will be advised to switch to active management. And so that brings me to the end of this video. I hope you got value for it. If you did, kindly give me a like and subscribe to my channel, because here I talk about fertility, women's health, and everything health. If you have any questions, leave them for me in the comment section and I will answer them all. And also, if you have any topics you would like me to talk about, kindly leave them in the comment section and I will do them for you. Thank you for watching and I'll see you in my next video. Bye for now.